Hi, everybody. Can everybody hear me? Okay. We're just going to wait another minute or so. We are just, if any of the committee members came on and they're on their telephone besides John McGowan, can you just let us know? Because we just see you as caller numbers.
I can unmute the phone.
How do you do that? Do you know they don't know they are? No. They're on the phone. Can I just ask whoever has the TV on in the background, if mute yourself. They can't mute themselves on the phone?
I mean, there's a button, but I'm sure they don't know.
Okay.
Let me just see. And when you want everyone to talk, we'll unmute everybody.
Okay, I'm going to start. I think we are missing a couple of people. Hopefully they will be joining us shortly. But in the interest of time, I know everybody has time issues. I'm going to start the meeting. So as most of you probably know, in June of this year, Governor Cuomo signed an executive order which was entitled the New York State Police Reform and Reinventive Collaborative. It required every local government agency that had a police department to adopt a policing reform plan by April of next year. So to that end, the Chief Butterworth and myself met and we formed a committee. And I'm just going to introduce the members, most who I think are here, hopefully. So in addition to Chief Donald Butterworth and myself, we have Captain Michael Shannon from the Orangetown Police Department, Councilman Dennis Troy, from Orangetown, Mayor of Nyack, Don Hammond, Dominic Crispino and Barbara Gianto, who are both first assistant district attorneys here in Rockland County. We have Tanya Gale, who's with the Nyack NAACP and from the Public Defender's Office in Rockland. John McGowan, who's a county legislator. He's on youth court and a Pearl River resident. We have Pastor Brandon McLaughlin. He's the pastor of St. Charles AME Zion Church in Spark Hill. We have Willie Outlaw, who is a Tapan resident. We have Orangetown Sergeant and PBA President Nicholas Whalen. We have our newest member, who I see who has joined us, is Jarrell Jones, who is a Nyack high school teacher and coach. We have Deputy Town Attorney Elizabeth Brancotti, Deputy Town Supervisor Michael Lawler, and our clerk Allison Carden. So I want to just personally take a moment to thank all of them for being involved in this very important project. They're most are using their own personal time to be here. And it is very much appreciated and very much important assignment that they've agreed to take on. So in looking at, the governor sent a manual, it's like 130 pages or whatever, and I have read through the whole thing, but I think collaborative is the key word that he has in the name. It means working together. It means we were charged with basically reviewing the needs of the community in which Orangetown police serve, and to evaluate the current policies and procedures of our police department. And we need to include the entire community in the discussion. So that is what tonight is the start of. The committee wants to start early. Hopefully this is only one of several public and outreaches that we're going to have. But eventually the committee must come up with a policy recommendations that they're going to present to the public. So there will be an ultimate plan that the public can comment on. And then ultimately it goes to the town board to pass for adoption. So we have, a lot of work ahead of us, but we wanted to start early with getting the public involved. So to date, just so the public knows what we've already been doing, we have had a presentation. We have a couple of presentations. One we had was Ray Florida from the BHRT, or BERT, the Behavioral Health Response Team. We had one from Daphne Joslin and Gabrielle Hamilton from the Mental Health Committee of Rockland Coalition to End the New Jim Crow. We had Christopher Stratner, who is an instructor at the Rockland County Police and Public Safety Academy. And we had Sergeant Nick Whalen make a presentation on the New York State Law Enforcement Accreditation Program. So we've already gotten a kind of a jump start on it. But there's a lot more we need to do. And like I said, we wanted to open it up to the public early. So for tonight's meeting, we are not really looking to get into specific practice questions that will come, but it's really just to open up the dialogue and give everyone who wants an opportunity to voice what they see as the issues or concerns that we should be looking at, give us ideas for how we can make the process more effective and how we can reach the mass, how we can get our, more people to come involved. And then any other comments which anyone thinks would be helpful to the committees to make the process more collaborative, which is really what our goal is. With that said, if anybody has any specific questions or doesn't want to say anything in a public meeting, we have a dedicated email address, which is policereform@orangetown.com.
Overall, there have been more than 409,000 cases in the state.
Chris, you're mute.
There you go. There you go. I'll start again now. We had to mute everybody because music came on. So if everyone could just mute themselves, it would make it a little bit easier. Anyway, so as I was saying, we have a dedicated email address, policereform@orangetown.com. If you want to send an email in with specific questions, we will make sure it gets to the appropriate party to give you a specific answer. It's going to come into my office. I will be the only one that sees it, so it's confidential. And so feel free again if you want to get more specific or don't want to ask a question tonight to email policereform@orangetown.com. And then you can find additional information about what the committee is doing and updates on our town website, which is orangetown.com. So there's plenty of resources out there if you're not interested in speaking necessarily tonight. Before I open it up to the public, now it's going to be tricky because we don't, some are on phones. If you want to speak, if you could just put in the, I don't know how you do with the phone though. Okay, so we're going to start with people who are on, anyone wants to speak, if you go into the chat box and just put, you want to comment in your name, we will call you. The phones do get a little trickier. We're going to have to figure that out. This particular program does not work well necessarily to identify people on phones, but we'll do our best. So before I do, I just want to open it up to any of the committee members. If anybody wants to say something on the committee, let me know. I'm happy to let you have a couple words. Do I have to unmute them? Okay. We're going to unmute everybody, so in case anybody wants to say something. Dennis, you want to say something?
No, I'm good.
No.
This is Brandon McLaughlin, Pastor Brandon McLaughlin. I'm just hoping that we are able to have a great meeting and great dialogue. And I also wanted just to be known that this is collaborative, and I'm excited about that. This has been the community and police working together to do this. I saw some negative comments, but I just wanted it to be known that this is collaborative. We're not fighting each other. We're trying to get what's best for our community together. And so I just wanted to throw that out there.
Thank you. And that makes two of us. Or probably more than two of us, but at least two of us. Okay, so it doesn't look like any of my committee members have anything else. So I'm going to open it up to the public. Again, it's kind of It's gonna be a little tricky. I'm gonna look again. If you want to comment, you just say you want to comment and we can, make sure you're on the, if you're on your computer. After that, we're gonna open it up to the screen names. I don't intend on putting any time limitations on it. I think we have enough time, but if we do see it going into, we may have to limit the time so other speakers can speak. So I'm gonna take a quick look. Okay, so I see, well, there's a question. Vicky is asking, is the first open meeting regarding? Okay, so we'll just respond to some of the questions. I guess maybe it's easier. So, Vicky, we've had a couple of meetings. I would not say they were closed. We just didn't really publish them necessarily. I don't think the committee has any problem with the meetings being open. I know I don't have any problem with that. So moving forward, we will let, on our website, or we'll get the word out that the meetings, when they're being held. With that said, you can certainly view, but we're not going to be entertaining comments at every meeting we have, but you're certainly welcome to look at the presentations and hear what we're hearing. Okay, I'm just going to read the questions. So from Paul Weiss, we have a question about the Rockland People's Panel on Policing. So I did view the Rockland People's Panel on Policing. They had their first virtual meeting. I've been in contact with some of the members that are on it to find out how we're going to be working together. My understanding is they are looking to work in conjunction with us, going back to Pastor McLaughlin's collaboratively. But they're kind of doing their own thing, and then we're going to kind of meet up in the middle. But I viewed the meeting, but I'm not a member on the committee.
Platforms for updates on whether they're going to let us know on power out.
Okay, so Rena Finkelstein, we would certainly let you speak. Can you see Rena? She was had a picture there before. Rena, can you hear me?
Okay, I don't have it.
Okay, Rena? That's funny. She was there a minute ago. And she's unmuted?
She's unmuted, yeah.
Okay. Rena, you said you wanted to speak. You're up now. Okay. We'll have to circle back to her. You want to comment here? Maybe we can respond to her that she can speak. RENA. In the meantime, is anybody else who's on a phone want to speak?
Yes, I would like to speak.
Okay. Just.
Okay, I don't know. My name is Dr. Manowara Begum. Hi, I'm an Orangetown resident. I have worked, I'm a psychiatrist by profession, and I worked in Rockland Psychiatric Center for 30 years. Currently working in Summit School in Nyack, which is a residential treatment center. So I have been living in Orangeburg, actually in Tapan for 30 some years, and had always had good experiences with Orangetown police. Over the years I had to call them. So I want to thank all of the police department who is present there. But as a psychiatrist, what I would like to bring up I think when mentally ill, person in crisis, I think there is some improvement needed, how the call is handled in terms of, police getting involved. Sometimes, in a crisis situation, things can go out of control and the person can get hurt. So I think in terms of training of the police officers and not to, go with their gear and not to make situation, more intimidating to a person who might be in a crisis and might be feeling very anxious or paranoid, So I think, overall involvement, some kind of training for de-escalation is very important. As you know, in January, there was a person with mental illness in crisis was tasered, and unfortunately, she died. So to avoid situations like that, how our mental health response team and the police can work together, or if we can come up with an alternative, to have a separate, just a mental health team deal with the, person in crisis, so that we can avoid any kind of injury. So, some kind of training, de-escalation, because when I worked in Rockland Psychiatric Center, when our patients got very agitated or violent, we did restrain them, but without, getting them hurt or the staff getting hurt, So I think since now the police do respond to situations like that, so some kind of de-escalation training is very important. But down the line, I think we do have to also open up a discussion about, just having the mental health response team respond to the situations who are trained rather than getting police involved, because it's also stressful for the police when they are not familiar with the mental health. So that is my comment. Thank you for listening.
Thank you. And you raise a very important point, and one which the committee is aware of. Like I said, we did have a presentation from the Behavioral Health Response Team and the Mental Health Committee on the Rockland Coalition to End the New Jim Crow. And they both are along the same lines, that what you just said, that we need more maybe, counselors or someone to go to these kind of high risk situations. So we are definitely working on it. It is, and I agree with you 100%. I think the whole committee would agree with you. And it's something which will ultimately come down to a funding issue, because the Behavioral Health Response Team, what they do sounds incredible. It just sounds like they need more resources. So it's a very, very important point. So does anybody else want to speak? Did we?
I think oh, no,
She's gone again.
this one.
Okay,
Let me unmute her.
we'll unmute you. Hold on a sec.
No. Let me get back over here. Her name is Taylor, right? I think she has to unmute herself.
Oh, you may need to unmute yourself. Is that Julie? Yeah, I think, there you
hi,
go.
sorry.
That's okay.
Like I'm supposed to. Sorry. I'm Julie Finnefrock. I am an LMSW working with clients in private practice in the area. And I wanted to piggyback on something that Dr. Begum said. I am also on the Mental Health Committee for the Rockland Coalition to End the New Jim Crow. And I wanted to share an experience that I had that I feel that I had with a client. I feel like really puts kind of the whole thing, it kind of shines a light on the whole thing. I had a client who was in crisis, and I had to call 911 for this client. And this client was a person of color who had had very negative interactions with police officers and had been injured during those interactions. So the client was actively suicidal, and I had no choice but to call 911. And we were able to be with him during the whole time that EMTs came, police came, and it was overall a very positive experience. So I want to say that because I was advocating for him and I was very clear with dispatchers that this was going on. He ended up getting the help he needed, and I think in a pretty positive way, but it took so much advocacy to make that happen. And then the other piece that I want to mention is that the police officer who arrived on the scene hung out for an hour after that, talking to me about his needs and how he felt completely unprepared to deal with some of the folks that he was, basically providing like emergency triage to and wasn't trained for it. So he was talking about his own trauma And I think one thing that we've been doing on the mental health committee is we've been investigating all these models all over the country. Some of them don't use police officers. And one thing that's become really clear for me is that trauma begets trauma. And so when police officers are constantly traumatized, doing a job that they are not trained for, that we are trained for, mental health workers are trained for, then de-escalation is going to be much more difficult. If you are seeing every scene as a crime scene, then it's going to be much more difficult to meet the needs of people with disabilities, people with autism, people in crisis, people using substances. And so I think I agree that the behavioral health response team is on the right track, and they need many, many more resources to continue their work if that's how we decide that this needs to go. But I also want to speak to Dr. Begum's point, which is that sometimes just having someone arrive in uniform is traumatizing, and it's triggering, and it's scary. And so I think there's a middle road here where we can meet the needs of our community without increased violence, the potential for violence to our community or our officers. And that's my comment.
Thank you. Thank you. Yeah, like I said, we had the presentation from the mental health committee from Rockland, and they were great. I mean, I think we've all learned a lot. And I do know, that Chris Stratner from the police academy, who's an instructor, did say that he's working to bring them in to the academy. Going back to your point that the police officers are traumatized too, I can only imagine. So very important. Do we have, I think she's what's her name? The woman's back. Somebody else want to speak? Rena, did you want to speak?
Her sound is off.
Oh, I see.
She's a caller. Oh, let me get her. I think she's calling.
Okay, hold on, Rena. I think we found you.
Oh, okay, but I'm calling through the telephone. So I have, I hope I don't repeat something that was already said, but I'm a long-time Rockland County resident, and I've lived in Orangetown now for 16 years and in Spring Valley for 51 years before. And I formerly headed up NAMI Rockland, which is the National Alliance for Mental Illness of Rockland County, for 30 years. And I am actually the mother of a son living with serious mental illness. And in my work with NAMI, where I did support and education and advocacy for families with loved ones who are similarly impacted by mental health challenges, I've heard many tragic stories, and that includes accounts of interactions with local police. And I can tell you that families and their loved ones suffer pain, trauma, stigma, and often discrimination from many sources. Although the psychiatric hospitals, perhaps Mona pointed that out, have emptied out drastically, prisons and jails have a disproportionate number of individuals with mental illness and substance abuse disorders, as well as Black and Brown people. Racial bias is systemic in the United States. And although it's more obvious in the South, it does exist, maybe more subtly here in the North, but in Rockland County as well. People tend to fear and think less of those who are different than themselves. People with mental disorders, people of another skin color. Racial bias, unfortunately, is part of our cultural climate in housing, educational and economic opportunities, and it's certainly not exclusive to the police. But today, in response to the protests across their country and also because of Executive Order 203, which you mentioned, we have a rare opportunity to make some changes in our community to benefit these others, different people, and I believe in the long run to the police. Currently, I also am part of the Mental Health Committee of the Rockland County Coalition to End the New Jim Crow. And I want to thank you for giving our chairman an opportunity to really discuss our progress and some of our proposals, at an earlier meeting. But as you know, we've been researching alternatives to the police that can respond to crises, de-escalate, and get appropriate help for people with all kinds of mental challenges, homelessness, and other non-criminal situations that is humane and will benefit these people Confrontations with the police causes extreme trauma and fear for individuals in crisis. If someone's already confused and annoyed, when 6 or 7 police show up, which are fully armed with lights flashing, bringing out all the neighbors, it often escalates rather than calms the situation. And it's estimated that 20 to 50% of fatal encounters with police involved a person with mental illness, while people with untreated mental illness are 16 times more likely to be killed by law enforcement during a police encounter than other people. And the risk is compounded for people of color, with Black and brown men being 2.5 times more likely to die. I firmly believe that crisis interventions for such situations needs to be left to trained professionals. Police responsibilities need to be redirected so the police don't have to deal with medical emergencies, mental health crises, homelessness, conflict resolution. And additionally, the program that our committee was recommended, the IDEAL program, which is CAHOOTS in Eugene, Oregon, has been adapted to many cities and smaller areas throughout the United States. And it's resulted in substantial cost savings that can be used for needed social services. It frees police and the DA's office to solve and prosecute crimes and arrest real criminals. At the same time, all police, we believe, and I believe, should receive more training for CIT de-escalation techniques and sensitivity to racial bias skills for situations that come up in whatever they do. So again, I'd like to thank Supervisor Kenny and the legislators and all of the members of the task force for allowing me and others to make this public comment. And I feel that positive changes cannot be made individually by Orangetown. And we have, I believe, some 10 separate task forces. All of them, like Orangetown, must have the benefit of community input and research and collaborate and work together to develop a single coordinated countywide plan. So I hope that you will urge and encourage this kind of interaction among all of the task forces. Thank you again for allowing me to speak.
Thank you. I just want to remind everybody, because I know there's people coming and going, that anybody who either doesn't want to speak or wants to follow up on an email, we do have a dedicated email, which is policereform@orangetown.com. Again, it will come in straight to town attorney, into the town supervisor's office, and it's going to be confidential. But if you're asking questions, we will reach out to the appropriate parties. So on that, I know it's difficult if you're on a phone, but if anybody else would like to speak, we're going to unmute the phone people, and you can just.
Yes, hello?
Yes. Go ahead.
Yes, hello. This is Edgar Castro. I live in the town of Orangetown. My question is to those that made the presentation is, at one point could there be a level of like a threshold level as to what point do you bring in the police officer use the training in terms of, okay, this situation doesn't call for me intervening directly, try to de-escalate the situation, as opposed to what happened, let's say, the other day in the city with the, let's say, St. John the Divine shooting or any other type of shooting where an individual that he or she may not be unstable or is basically doing acts of aggression to which the point, there is life-threatening situations are involved.
I don't know. There sounded like there was a question in there. What I would say so far, again, is that we've had presentations, and I think there's an acknowledgement from what we've heard so far that the de-escalation through these organizations that are providing mental health crisis response team instead need to coordinate and maybe work with training with the police departments when is again, I try to put myself in their shoes. And if they don't call the police, they call the mental health, and then something happens to somebody, they're going to blame the police, so it involves training to know when it's appropriate to send, mental health crisis response. Again, the nice thing about that is they told us they don't wear uniforms, they don't have lights on the car, they don't, whatever, but they may need police's backup. So it's something that is being looked at. I think that's what your question was. I don't have the answer certainly, but I think it's something that is important to investigate further. If that answers your question.
Yes,
Okay,
thank you.
you're welcome. Jackie? Jackie Drexler. I'm saying it. I apologize if you mutilated your name, but we're trying.
She has to unmute herself.
Oh, Jackie, you may have to unmute yourself. I'm glad I'm not the only one with technological problems.
All right, I'll unmute the phone.
Okay, we're going to unmute the phones again and give it a shot. Okay, I don't know, Jackie, are you on there? Can you?
Kathy Kelly, did you want to speak?
Oh, I don't know. Kathy Kelly, are you looking to speak?
I was waiting to be called.
Okay, I'm calling you now because poor Jackie can't unmute herself,
Okay.
so I'll call on you.
Sorry, Jackie. I wanted to thank everyone for always having a community voice. I think that's very important. But being the wife of a sergeant in the police department and listening to the presentations, which I appreciate, I think sometimes that there's a disconnect to how quickly situations can escalate. And when you bring mental health practitioners in, I'm a doctor of nursing, so I'm very versed in mental health. And I think there's a time and a place for everything. But out in the community, out in the street, when things can escalate quickly, to then try to call the police department in, life-saving minutes can be lost. And I think when we say that the mental health practitioners should go in, but the police should be ready to be backup, I think it's almost unfair to the police to say that, because then we are expecting them to stand down until things escalate. And then when they do go in and do what they're trained to do, then they're going to be lambasted in the media. It almost seems very unfair. So I'm hoping that there can be further conversation on, really the best plan for everyone, because no one wants anyone to get hurt. No one wants mental health practitioners to be hurt or citizens to be hurt. But I think we have to look at the big picture just a little better. And those are just my thoughts. But thank you for allowing the community input on this.
Thank you. And you know what, I'm just going to say, I don't disagree with you, Kathy. What I would say is that people way more versed in this area is why we're doing this. It's to get people who are much more versed to help us find what the right balance is. I know I am not that person, but I'm welcome to people who are. Jackie, did we find you yet? In the meantime, is there anybody else who would like to speak? Oh, Eileen Kennedy asked if it's going to be taped.
Yes.
Okay. So for anybody, I just see people coming and going. This is on Facebook Live, so I believe you can watch that at any point. And we are going to put it on YouTube on the town website. For anybody who missed it, if they want to go back or rewatch it, whatever, it will be on the town website also. Okay, anybody else? I know it's difficult in this forum. Oh, Jackie has arrived. I see something now. Oh, that's what it said.
Can you hear me now?
Yeah, we can hear you.
Oh, yay.
Welcome.
I had to go out of this and go into some other system.
I know it's not easy.
Okay.
It's, But thank you
Good.
for being patient, not giving
No,
up.
thank you. So, first of all, I do want to say how well, I used to live in Palisades for many, many years. I was a Orangetown resident. Now I live in Valley Cottage in Clarkstown. I do want to say how much I appreciate that this is an open to the public meeting, because we've heard about so many different meetings that haven't been open to the public. So it's very refreshing. And I really appreciate that you're doing this, first of all. Second of all, I do just want to say something, growing up in Rockland County, if there were mental health problems, they were certainly secret. Believe it or not, I know there was a lot of substance abuse going on, but we didn't have the kinds necessarily of mental health problems that we're seeing so much of today, just in general in our population. So, and people are so much on the edge with so many things in their lives that have changed because of COVID that the things can escalate very quickly if there's already a problem. I did want to say, as Rena said, that this is a rare opportunity to try to look at policies and procedures across the entire county to have some sort of uniform way of handling things. And I also wanted to address the person who is worried about, if there's someone who really is a danger, possibly with a weapon. I am with the Rockland Coalition to End the New Jim Crow Mental Health Committee as well. And what we did find is that a lot of the calls come into a center where they're triaged with professionals to determine if that's something that needs the backup of the police, to begin with. So there's the worker's safety, there's the person's safety, there's the police safety, there's respecting that the police do know certain things and have to be called in certain situations. So this is not just like, oh, let's only send out mental health teams. This is not to be disregarding police. It's just to say that mental health professionals and peer advocates are people who can work with someone who's in a crisis more easily than police and can de-escalate in a different kind of way. So I did want to bring that up, and I'm hoping that these meetings that are public that you're having, that the other communities that are organizing to look at this Executive Order 203, that they'll also make their meetings public, because it's really important for the public to know what's going on. And so once again, thank you very much. That's all.
Thank you. Does anybody else would like to say anything? I mean, I'll just add to what was just said. In speaking with one of our police officers the other day, he did mention that domestic calls are on the rise, and that's a direct correlation probably to the pandemic and people being stressed and whatever. So, it goes across a broad spectrum with needing people to intervene in these things. But we are reaching out to all the organizations. We're reaching out to the Family for Safety and Change. We worked out to the Pride Center. We're reached out to the NIAC Center. We're trying to reach as many organizations that may have ideas and suggestions and want to be involved. So we are trying to do outreach. So if anybody thinks of any other organization that we should outreach to, again, you can either just say it here, or again, you can email policereform@orangetown.com, and we will reach out to those parties.
Recent.
Okay. Yeah. Go ahead, Dennis.
Have we had any input from the dispatches, the police dispatches or the county dispatches, in terms of the types of calls that they get, in terms of how they do a triage?
We have not, but I will put it on the top of my list for our next meeting.
Yeah, the only reason I'm saying that is because to me, I would think it's very hard to identify, in a particularly domestic dispute, whether the people, there might be a mental health issue, but the other thing, there may be the person who's making the call feels physically threatened or whatever. And I would assume that the dispatches are trained. Now, I'm sure they get some type of training, but in terms of the mental health training, maybe that's something else that should be looked at.
Yeah. I agree. Okay, if nobody else, I don't want to rush anybody, but I don't want us all to sit here and look at each other either if nobody has anything to say. I will just, again, remind everybody that there's the email, okay, again, because I know some people don't like either speaking publicly or don't want to be speaking in one of these virtual settings. They are free to, like I said, to email. And we will be putting information up on the website about the meetings and what's going on. So there's plenty of information there. And if nobody else wants to speak, going once.
This is Pastor McLaughlin. I just wanted to quickly say, I know some people don't think that, seeing a police officer can trigger, because I've seen a lot of people say, I've had great experiences with police officers and I've had good interaction with police officers as well. But I've also had some negative ones as a person of color. And that fear is there for a lot of us. And I hate, and I'm glad we're having this time to talk, because I hope that people don't trivialize, how people of color feel. It's different. When it's different when you have to walk in our shoes. For me, turning my turn signal on can be a matter of life and death, because if I get pulled over and someone, something escalates, it's just different. I've been pulled over one time. The last time I got pulled over is because the officer said I had fresh damage on my car, something that a lot of people don't have to deal with. And so I don't want people to trivialize, just think that, no, I've had great experiences. Yes, you might have, but there's another community that has a pain that I hope that you will at least talk with us. If you don't agree, that's one thing, but at least have conversation with us to understand what we're going through and how we feel about the things that are going on. It's no one's painting every police officer is bad. The same way that I hope nobody paints every preacher as bad when one pastor does something wrong. But we do want to have real conversations about the trauma that is taking place. And I hope that we can continue on and have healthy dialogue as a community, as people that are living here in Orangetown. And so that's just all I wanted to say. And I love all of you.
Thanks, Brandon. I knew there was a reason I asked you to be on this committee. You bring the you say it like it is. And so I appreciate you for stepping up and being on the committee. I appreciate everybody who stepped up to be on the committee. It's not easy. It's not easy sometimes to, have these conversations, but they have to be had. So thank you. Thank you to everybody. And if nobody else wants to say anything, I'm going to end the meeting. And just for my committee members, we will be hosting another. I think we're aiming for January 12th for the next meeting. But again, there will be information forthcoming and can be found on the website. So with that, everybody have a good night. And again, I'm an email away. So feel free to email if you feel you need to do so. Thanks.
Thank you. Happy holidays.
To you too.
Thank you.
Thank you, Supervisor Kenny.